I was very drawn to the HSA plans, the high deductible health plans that offered an HSA. In the investing world, we talk about how they have these amazing tax benefits. Tell me the case against the HSA. Like, is it ever a bad idea to choose the plan with the HSA?
Yeah, so you're right. An HSA is only an option if you roll in a high deductible health plan. So these are actually quite popular. People who get insurance from their employer, more than a third actually opt into a high deductible health plan. Simply put, a high deductible health plan is an insurance plan that meets IRS requirements for both deductibles and out-of-pocket expenses. And honestly, they're a way for employers to share more of the cost with an employee. So deductibles in these plans are usually higher, around $1,200 to $1,800 as compared to, say, the PPO or the HMO that we spoke about. And they usually follow a co-insurance model, which for me is, again, kind of that one ding. There are certainly some that have a co-pay model, but you have to look out for that. Premiums can be lower, which is a great advantage of a high deductible health plan, especially, in your situation, you're young, you're healthy, you don't have kids. But actually, again, the Kaiser Family Foundation found that for single coverage, premiums actually aren't that much lower, maybe like $150, $200 lower than, say, a PPO. For a family, they're significantly lower, like we're talking thousands of dollars. So the main benefit, though, of a high deductible health plan is that HSA. And you're right, HSAs are great long-term investments, but again, sometimes I think as we're making these decisions, acronyms are thrown at us left and right, and we don't always necessarily understand how to use these tools. And so an HSA, you can think of it like an investment account, and you can put money into it as long as you're in the high deductible health plan. Your employer can also put money into it, whether they do or not, and you can invest it and grow it. You own it, which is different from an FSA, which an employer owns, which you can't take with you and it doesn't roll over. An HSA you can grow, but you can only invest in it when you're in a high deductible health plan. And so I would argue that a high deductible health plan and an HSA can be extremely advantageous if you're single or you're married with no kids, if you're relatively healthy, meaning you don't really plan to use your HSA to cover costs for your health care in that year, and if you're financially stable enough to front load your health insurance costs. Because again, your deductible is going to be much higher than the average PPO, and you're going to have to pay all of that before you see any benefit whatsoever from your health plan. So can you afford to do that without putting yourself in any sort of financial jeopardy?
Totally. And, I kind of want to dig a little bit deeper here, if you don't mind, because I think in the past, I have looked at the tax benefits of loading the HSA, marginal tax rate, payroll tax liability multiplied by the amount that you're contributing. It can easily be in the thousands of dollars in tax savings. And so when I've kind of done these types of comparisons between the higher deductible health plans that I had access to and the lower deductible plans that had higher premiums, I would find that in a lot of cases, when I factored in the tax savings, I was getting further ahead from the high deductible plan. Can you walk me through, I guess, the issue that you see with them maybe not being as lucrative as they seem?
Yeah, absolutely. And first, let's just make sure we're all on the same page. An HSA is triple tax advantage, which means the money you're putting into it is pre-tax. When you invest it, the growth is not taxed. And then when you ultimately use it for qualified expenses, that is not taxed either. So it is a really awesome tool. I would think of it and invest in it similar to a 401k. So say you have an HSA contribution that it has a limit, just like a 401k has a limit. For 2023, those limits are around like 3,800 for individuals and 7,800 for families. And so you're right, you can crunch the numbers and you can look at the tax savings and easily be in the thousands. When you crunch the numbers, say for the federal tax advantage, the maximum family contribution can be a few $100s to a few $1,000s. But when you then put that up against your high deductible, which is again going to be thousands of dollars, it starts to become a wash for that specific year. So there again, that's why I go back to, don't think of your HSA as the money you're putting in a tax advantage account to use in the same year. That's not where you're actually going to get the tax advantage. You're going to get it in the growth and you're going to get it in the compounding over the next 10, 20, 30 years. That's where you really start to see the advantage. Now, having said all of that, an HSA is a very powerful long-term investment tool. And even say you only enroll in an HSA once, right? So you're very healthy, you feel confident that, God forbid, nothing catastrophic is going to happen to you. So let's get in the high deductible health plan. You're financially stable. If things go sideways, you're still going to be fine. And you contribute the maximum you can into your HSA. That can easily grow into 6 digits by the time you retire. So it is incredibly powerful. And especially given that healthcare retirement costs today are north of $300K, it's something folks should really consider. The biggest caveat here is that you have to be prepared in case you encounter those unexpected healthcare issues. So a really stark statistic is that 50% of bankruptcies in the US are due to illness or job-related loss, illness-related job loss. So when you think of that, again, you just want to be educated when you're making that decision. You want to make sure that you're not putting yourself or your family in financial jeopardy just in hopes that you have a good year, you don't have to use your health plan, and things go well. The other reason I'm not the biggest fan of this kind of carrot incentive is because it really does incentivize people to not use their health care. So for me, I've got a cold. Yeah, do I feel like crap? Sure. Am I going to go to the doctor? I probably would be more likely if I had a PPO and I'd already met my deductible, but not as likely if I have a high deductible health plan and I haven't. And then again, when you throw kids into the mix, I'm never going to say, oh, my kid has a fever, but let's not send him to the doctor because I don't want to have to pay my deductible. Right. But sometimes people are put in positions to make those choices. So just don't put yourself in that position if you're not able. So I have a few questions, kind of key questions that I tell people to always ask themselves when they're trying to decide, is an HSA a good idea for me today? And again, maybe it is today, maybe it's not. Next year could be different. But 1, can you afford to pay your entire deductible in the first 3 to 5 months of the year? Is that in your budget? 2, if necessary, can you pay your entire out-of-pocket maximum for the year without putting yourself into any sort of financial turmoil? And 3, can you pay your healthcare costs without dipping into your HSA? Because again, the tax advantage for the year versus the deductible for the year make the year-to-year kind of a wash. So if you can answer yes to all those questions, then yeah, go for it.
Amazing. I want to reiterate too, just to really drive it home, that you're absolutely right. If your plan is to put the funds in and then turn around and spend them same year, you're not really getting the tax advantage. Like, you probably would have been better off going with the lower deductible plan. You get the tax advantage when you think about the HSA as a long-term investment strategy, a long-term investment tool. And then to your point, if you're on the fence, I love that you highlighted, because we've talked about this before with budgeting for healthcare expenses. When you're signing up for the plan, you want to look at that out-of-pocket maximum and make sure that you have a plan in place with your budget and the way that you're allocating your income every month to be setting aside that much money over the course of a year. Like, you want to have at least your out-of-pocket max in an emergency fund, right? Because that you could be paying that much through one freak accident. So I love that you highlighted that and kind of it is a trade-off, right? It's a risk. And I think in some cases it's a risk worth taking, because to your point, by the time you reach retirement, you're going to need hundreds of thousands of dollars. So what better way than by investing through an HSA and getting all of it tax-free? But by the same token, if you are someone that is maybe not earning a lot now and the out-of-pocket max for the high deductible plan is $15,000, well, it's a risk analysis that you want to take. So the other thing that I noticed, we keep kind of coming back to this idea of, like, if you are single or if you don't have any kids, and kind of how this whole picture changes once the healthcare plan is covering a family. Can you explain why children would become like the high deductible health plan deal breaker for you?
Oh my God, gladly. Because kids are just crazy expensive. Like, I love them. They're so worth it. But in every aspect of life, they're expensive. Health is no different. And things are just really unpredictable. My son 2 weeks ago was standing at the bottom of our stairs, behaving himself, holding a railing, and a gust of wind blew by and he slipped, just like out of nowhere slipped. And it would have been a nothing issue except for he slipped into the staircase, and we ended up in the hospital for 8 hours getting, a plastic surgeon putting in 3 stitches, and he's fine. He's great. He like loved all the attention and the balloons and everything that he got with it. But that is, again, thousands and thousands and thousands. Like, not all of it has even hit our account yet. And I saw one person's bill who literally saw him for 30 seconds, and it's like $2,000. So, again, usually that won't happen to me. Like, I usually can like catch myself if I slip while I'm just standing randomly near the staircase. But it's like that for kids all the time. And as they get older, they're in sports, they're doing different things, and they just are more prone. So if you want to reach your high deductible really quickly, or if you really want to give your out-of-pocket maximum a run for its money, then yeah, go for the high deductible health plan with kids.